Hello everyone, my name is Sandy Varghese and my topic is about nursing shortage. I currently work as a certified nursing assistant at Vanderbilt University and I see firsthand the effects of nursing shortage. In fact, in our department, we're currently short-staffed and we have to rely on travel nurses to fill our vacancies. This is only a short-term solution, but it's a very expensive solution. We eventually have to hire nurses who have the capabilities and experience to work in an ICU setting. The purpose of my PowerPoint is to show the cause and effect nursing shortage has on the hospital, and also maybe offer up some solutions that may help with this crisis. So let's get started. Nursing shortage impacts all aspects of healthcare. Countries around the world from North America to Europe and even Africa is in need of nurses. According to National Center for Health Workforce, 36% of nursing positions will not be filled by 2020. Also, according to American Nurses Association, by 2020, if the crisis is not addressed, the need for RNs could rise to 1 million. By 2020, the need for nurses will increase by 30 to 35%. This is most probably due to aging baby boomers who were born between the years of 1947 and 1962, who are most probably going to retire. The average working age of registered nurses increased by 4.5 years, which means that the average age from 2000 to 2010 is 41.9 years. Within 10 years, the average age of working RNs will go up to 50 years or older. And eventually, when these baby boomer RNs retire, it will decrease the supply of working nurses by 20% by the year 2020. And I definitely see this being an issue in the place of my employment, where I believe the average age is between 45 to 50 years. And eventually, when they retire, we're definitely going to have a shortage in my own department. Since World War II, United States have gone through periods of time where they're in dire need of nurses. In the 1990s, hospitals reduced the number of nurse-employed RNs to reduce cost. Within few years of reducing nursing population, hospitals experienced an increased demand for nurses. See, it seems like the nursing shortage is commonly referred to as supply and demand, and ever since World War II, United States have gone through a cyclical shortage of nurses, meaning that there are periods of time where their hospitals are fully staffed, or there are periods of time where hospitals are very understaffed and in dire need of nurses. Nursing is the fastest growing occupation, and jobs for nurses are expected to grow by 23% in the coming years. I know in this program there are students coming from across the country, and I just wanted to show a small illustration of what the need for nurses will be like in the year 2020. And since we live in Tennessee, you can see that Tennessee is in the gray, where we'll be in dire need of nurses. Out of 50 states, according to this illustration, it seems that only 4 states will be either fully staffed or won't have a shortage of nurses, which I consider to be amazing that 46 states will be in need of nurses. So let's talk about some of the factors that are causing the shortage in nursing. First is enrollment in nursing school is not growing as fast as the demand for nurses, not enough faculty members to teach the students. In fact, in 2012, 80,000 nursing school applicants were turned down due to lack of faculty to teach students. So I want you guys to think about this issue. On one side, you have the baby boomers who are getting ready to retire or leave the workforce. And on the other side, you have lack of faculty members to teach new nursing students. So obviously, when you combine those two issues, you can see how it causes the shortage in nursing. Another issue is lack of clinical sites for students.
It is very important that students are able to practice what they're being taught in the classrooms and be able to actually use those skills on real patients. These are valuable experiences, so when they're actually out of nursing school and in the work setting, they won't be scared of the patients, they will be prepared to meet the needs of the patients. Budget and low salary for faculty members. Faculty members not given the proper tools to teach their class efficiently, to teach their students efficiently and properly, and low salary for faculty members. I think that is an obvious issue. Another factor that causes nursing shortage is that the field of nursing is a career that offers many different opportunities. For example, nurses can go on to become nurse practitioners. They can do informatics. They can go into management and leadership roles. And all this creates even more vacancies in hospitals. During recent times of economic depression, nurses are forced to re-enter the workforce. But as soon as the economy recovers, they are more likely to retire. For example, in the recent years when the stock market crashed, we had many of the baby boomers who came back into the workforce, especially nurses who came back into the workforce because most of the money were tied up in stocks or savings. And when the stock market crashed, all their savings and stocks, they plummeted. And as soon as these baby boomers were financially secure again, they're more likely to retire. So again, it causes more vacancies in the field of nursing. I think one of the big factors that causes nursing shortage is the work environment. Let's face it, guys, nurses work under a very stressful environment. And when they have to come in every day and deal with short staffing and high nurse patient ratio, I've seen floors where it used to be 2-to-1 ratio. That means 2 patients to 1 nurse go from 3-to-1 and eventually 4-to-1. And some of these floors are ICU floors. It is not safe for the nurse, it's not safe for the patient. For one nurse to be taking care of a patient who is sick enough to be on an ICU floor. And low compensation. We obviously are not in the field of nursing because we know we're going to make a lot of money. We chose this field to help others, to take care of others. And lastly, nurses have to work in an abusive environment. And I don't necessarily mean that nurses are physically abused, but they can be verbally abused every day. And I see that on a constant basis in my work environment. Nurses have to deal with the patients, sometimes the patient's family, and also the doctors. And that can put a lot of stress on the nurse also. So how does all these different factors have an effect on patient care? I think it's pretty obvious that patient outcome and satisfaction will decline. Patients are going to be less likely to come into the hospital with an injury. They will only come in if the injury is too severe and unable to take care of themselves. I think quality of care is going to decrease. Vital signs are not going to be done on time. Medications are not going to be administered on time. Patients who need to ambulate probably going to develop blood clots. Patients who need to be turned in bed to keep from getting bed sores probably going to develop bed sores. These are all the factors, or these are all the things that can happen to a patient due to nursing shortage.
Finally, let's talk about some of the solutions that may help with this crisis. First of all, we have to start thinking about long-term solutions. Short-term solutions are hiring float pool nurses or travel nurses. We have to help with recruitment and retention, increase nursing school faculty, improve work environment for nurses, encourage nurses to come back into the workforce, provide educational and professional development, nurse residency programs for new graduates. Hopefully these solutions will one day help solve the crisis of nursing shortage.